All right, welcome everybody. Welcome to what is still a relatively new facility here on Church Street. New for an institution that's been here in the city and serving those in need for a long time, 180 plus years to be exact. Child and Family Services started out, Governor, I don't know if you know this, started out as an institution to care for widows and orphans of whalers lost at sea, and back in the 1840s. And now today, it is an institution that cares for those with myriad needs, all sorts of needs. That we're going to talk about a certain set of them here today. But I want to give a shout out to someone you'll hear from in a moment. That's Wendy Patella, who is the CEO of this institution, which has been going strong, and as you'll hear, is even stronger today. So mental health is something that's on the minds of a lot of folks, those who actually suffer from it and those who are close to those suffering from it, as well as those who are in positions to make policy to do something about it. We here in New Bedford, and I get it, people are tired of talking about the pandemic, but the reality is that in the wake of the pandemic, and we are in the wake of it, there's still a whole lot of need that didn't exist or manifest itself before the pandemic. And so to say that there is a mental health crisis is really not an overstatement here in Greater New Bedford and really across the country. The good news is that we've got folks who are doing a lot about it. Here at Child and Family Services with the new Community Behavioral Health Center, which you'll hear something about in a moment, which is going great. We just cut the ribbon on this place less than a year ago, and it is going like gangbusters. And for anybody that's familiar with what's happening, it is serving the needs here in the city and beyond very, very skillfully. But it takes funding and it takes leadership to get it done, and to realize to address the needs head on in a granular, compassionate fashion. And I just want to take the occasion to thank Governor Healy and Lieutenant Governor Driscoll, Secretary Walsh, for all of their hard work, for all their compassionate work in this area. They recognize that the mental health challenges of the day are pervasive, they are complex, but they are solvable. And Governor Healy's here today to talk about the work that she has done and is doing, and how it meets up with reality right here in this building and many other places around Massachusetts. I want to thank, by the way, the work of the legislature, which has been funding, who's made funding available. Al Medeiros from Representative Cabral's office is here, as well as Representative Bill Strauss, who've been big supporters of mental health services in Massachusetts. But walking the point on this has been Governor Healy, and it's my pleasure to introduce her today here in New Bedford. The work that you have been funding, Governor, is making a difference in our city and our region. I really want to thank you for that, and just offer up the podium to say even more. Thank you.
Great. Thank you so much, Mayor. Thank you. Thank you. It's great to be here today. Thank you so much, Mayor Mitchell. It's great to be back in New Bedford and down on the South Coast. The Lieutenant Governor and I, she just had to get on to chair a Seaport Council meeting, but we had the opportunity to spend time with Wendy and the incredible team, including clients, and it was really mind-blowing what's happening here. And so we're here today because we want to recognize this is Mental Health Awareness Month, and it's an opportunity, importantly, for us to talk about mental health and for us to talk about some of what we're looking to fund and do to celebrate some of the great providers who are out here all across the state. And I think really to drive home that mental health is so important, and we need to take care of ourselves and those around us. That includes their physical health and also their mental well-being. And we know that mental health presents a lot of challenges for a lot of people, and some of that's been made worse, yes, through the pandemic or through social media. I think the anxiety and the strain, the stress, particularly on our young people, is something that's really, really profound. And so we are all committed to addressing this. So I want to thank my team as well. Our Secretary of Health and Human Services, Kate Walsh, will speak in a moment and introduce the incredible members of her team, including our Assistant Secretary, Mike Levine, Dr. Lee Robinson, who's our Chief of Behavioral Health, and Liz Bosworth, who is our Behavioral Health Clinical Director. But this is part of our team in the administration working intensely on those issues. And you know, we can put forth policy and ideas. We can't do it without the funding and the support of our legislature. So I want to thank Representative Strauss, Representative Cabral, for their continued support, and the entire New Bedford delegation. But to Wendy Batolo and the team here at Child and Family Services, thank you for the opportunity for us to see the life-saving work that you do. You know, we know that there is a crisis in mental health. We hear it every day from people around the state, from young people, from their families, from their educators, from providers. It's also what not only the statewide data is telling us, it's also the national trend and what the national data is telling us. And so in light of that, we are really leaning into expanding mental health services around the state. And that includes this incredible program, which is a community behavioral health center, working with partners like CFS right here in New Bedford, Fall River, Plymouth. You have a wonderful, wonderful network here at CFS. I just am struck, and I want folks in the media to know this, that in just a year alone, our CBHCs have served more than 24,000 young people. 24,000 young people, and with every young people, their parents, brothers and sisters, caretakers, others, right, who benefit and are positively affected by that service. And they're making a big difference. We also know that the trend for far too long is that whether you're young or not so young, if you're having a mental health crisis, you often end up in an emergency room, one of our great hospitals, right? Which really are not the place to treat people with mental health. And we certainly don't want people waiting for access to care and services. So one of the things that's so impressive about the work that you all have done here at CFS is that your work has helped us reduce boarding in emergency rooms in hospitals, okay, for mental health by 63% in 1 year. That's amazing. That's amazing. And that's real impact. And it's impact that we can measure not only in statistics, but in hope, but in wellness and in well-being for those who need the care and their families. Today we were able to view the Youth Crisis Stabilization Unit. Again, it's just incredible. Instead of having to go to a hospital or emergency room, you were able to come here and have the kind of care and support that you need in a really caring and supportive environment. So congratulations to the team here for what you do. We're grateful to all of our CBHCs around the state, and know that the administration is looking to continue to support and grow this incredible network. And with that, I'd like to turn it over to our Secretary of Health and Human Services, Kate Walsh.
Thank you, Governor. Thank you. I'm really so excited to be here today because we get to spread the word and talk about community behavioral health centers. These are incredible programs offering incredible services. Absolutely anybody in our state can walk into a CBHC or call a crisis team to their home or location, and within an hour receive a full crisis evaluation. I want to give a big shout out to my team, Assistant Secretary Mike Levine, Dr. Lee Robinson, Liz Bosworth, and their whole team who worked tirelessly to set this program up. This is a new program. Government and new things don't always go together, so I'm really proud that we put something together that actually met the needs of the people we're trying to serve. Because as the governor said, these results are remarkable. I think better than we hoped. And it's just in time because, as the governor said, we are experiencing a youth mental health crisis. Our kids are not all right, but that's okay because we have a place to treat them. We have CBHCs. You're not the end-all be-all, but sometimes you might feel that way. But they're a very valuable piece of a continuum of care, a solution for our toolkit. CBHCs have youth crisis navigators, separate waiting rooms for kids and adolescents, child-trained teams of clinicians, and youth-specific crisis stabilization units. They make peer mentors available for kids and their parents. People who have experienced what you're feeling, people who can walk you through your feelings, and can talk about options and next steps, renewing your hope. CBHCs work closely with schools to coordinate treatment. You know, it seems like we've seen one today, like the one today that has even dedicated space in schools to see clients. So meeting our youth where they are. Kids are in school. That's where we need to be with services. So whether you're 16, 6, or 60, visiting alone or coming with a loved one or a family member, CBHCs can provide you high quality, timely care for a mental health crisis. And we want everyone in Massachusetts to know that there's an alternative to emergency rooms for mental health crises, and that you can get comprehensive, compassionate, confidential crisis care right in your own community, right here in New Bedford. And we're going to keep doing what we can at the state level to spread the word about CBHCs, but I hope you'll help us out. Tell a friend. Talk about it at school. Mention it to your neighbors. And if you're in crisis, call 988. Visit mass.gov/CBHC. Find your nearest center. Walk right on in. Now, to tell you more about what happens when you walk in, it's really my honor to turn this over to Wendy Botello, CEO of Child and Family Services. Thank you, Wendy.
I'd like to thank Governor Healy, Lieutenant Governor Driscoll, Secretary Kate Walsh, and everybody who's here today for bringing the attention that mental health deserves. Really, this administration has demanded a system change, a change that really makes a difference in access to care, appropriate funding that allows us to do the things that we really have always wanted to do and weren't always able to. And the attention, right? Highlighting and spotlighting mental health and saying that it's okay to not be okay, right? The Behavioral Health Roadmap and the CBHCs have fundamentally changed the way that we have done business here at Child and Family. And we have really seen the positive impact. Right here in our communities, we see that we are servicing individuals. We've seen 10,000 individuals in our CBHC. We average about 12 new intakes every day into our clinics. Previously, we had a 6 to 9 month wait list. And the appropriate funding, the ability to change the system has absolutely changed the way that we do business, and absolutely for the better. When I hear from a young person that they were able to get the services that they needed right away, without going to an emergency room, to feel better, to address their mental health, to address substance use, right? To be able to work on what they needed to be able to work on, then I'm grateful that Child and Family is a part of this service care delivery system. Today I wear green. I wear green to support mental health. I wear green because there are so many people in our community who are struggling. And I want to remind them that we are here for them, we support you, and there is hope. I'd like to take a moment and invite Governor Healy back up to the podium for any further remarks.
No, thank you so much, Wendy. Again, many thanks to the wonderful providers here at Child and Family Services, unbelievable organization and demonstration of what's possible with CBHCs, and know that we are going to continue to look for ways to support families, especially our young people all across the state, because no family and no young person should have to live with or go through so much ordeal in just trying to get help, just trying to get care. And so I'm grateful to the administration, the team here at Health and Human Services and Mass Health for the work they've done in reimagining how we can better deliver care, and we're so grateful to our providers. So with that, thank you all for coming out today. Great, thank you. Great. Are there questions, or should we do? Okay, any questions on topic?
Any on topic first? Okay, go ahead, just for
Okay, great.
Yep, off topic, just in terms of housing, so we now know that the median price for a single-family home is more than $900,000. Just kind of your thoughts on that, and then the efforts to ensure that people can still afford a home in the greater Boston area.
Yeah, I mean, it's not just Greater Boston, it's across the entire state. It's why housing has been the top priority for our administration. We filed a $4 billion bond bill that will allow us to go out and borrow, to have money to spark production around the state. And that's new construction, it's preservation or rehabilitation, renovation of existing properties, whether they're old commercial properties or mills, whether it's state land that's not being utilized that we can turn into housing. This is the #1 priority for our state. We've got to go big in housing. We're behind a couple 100,000 units statewide. We haven't built enough housing for far too long. And we need housing in every community. We're a team and administration committed to working with cities and towns on this, ending exclusionary zoning practices, taking the steps, including through things like allowing accessory dwelling units, quick way to bring thousands of housing units online. But if we don't do this, we're not going to see the kind of growth that we need for our state, and we're going to see too many people leaving our state. Young people who can't afford to live here, who may have grown up here but can't afford to stay here. Older people who can't even afford to downsize here because property is too expensive. And companies who will leave our state or not grow in our state because they can't afford to house the talent that they need for their workforce. So this is solvable, but we've got to come together and act. It's the top priority for our administration.
Yeah, so last question, you basically kind of already answered this, but I want to say it was around last year, you had poked a little fun at Rhode Island, saying that it's a nice state to visit, but ultimately Massachusetts is the place to be. Would you kind of reconsider that, seeing as though the median price in Rhode Island is about $453,000, and then you have the price here in Boston being plus $900,000?
Yeah, and I love Rhode Island, so I wasn't making fun of Rhode Island. I grew up in New Hampshire. My family's from Massachusetts, and honestly, housing is an issue across this country. When I talk to governors from around the country, everybody's dealing with high costs of housing. But I know we can work together here in Massachusetts, and we can get it done. We can build the kind of housing that we need. We can rehabilitate 40,000 units of public housing that are sitting unused, vacant right now, because they need to be cleaned up. We can build more affordable housing in regions all across the state. And we can bring online more market rate housing, particularly around our transit hubs, because we know that's so important in terms of creating density for vibrancy in our community, and also to help us with emissions and our climate goals too, because we want people able to take public transit, which I know is very important to the South Coast. Trust me, we are committed to making sure that South Coast has the kind of public transit that it deserves. Thank you. Okay, great.
I don't think that many kids in my son's school even do it.
He makes fun of his friend who vapes.
He would never try it.
She's into soccer.
She's on the honor roll.
She's just not the type.
No way.
No way.
No way.
No way, my kid would never vape.
Get your head out of the cloud. Today, nearly 8,000 kids will start vaping. Maybe even yours. Learn about the dangers at talkaboutvaping.org.